YouTube link also I'm sending. Yeah, you can send now. Stroke patients. Hello and welcome to Seven Sentinels. This is Grandmaster class, and we are going to do the reading test. Stroke patients, part A. This is round 3. We have done 2 rounds till now. Round A is from 1 to 7, and round 2 is from 8 to 10. Now we are going to round 3. Question number 11. So go through this text once again. Stroke patients, text A. This is how to diagnose. Diagnosis. This is text B. Admission. Yeah. This is text number 3. C, that is a timeline. Then this is D. This is physiotherapy. Physiotherapy. So first one is a diagnosis, text A. Admission, text B. Text C is timeline. Text D is physiotherapy. Yeah. Now we have seen these questions yesterday from question number 1 to 10. This is round 2, question number 8, 9, and 10. We have seen this. 10th question. Okay. Right. Okay. I'm just waiting for some more students. So before some people come, we can make some slides. Question number 11. So question number 11. Yeah. Question number 11. Next one is question number 12. So that is 12, 13, 13. Question number 14. Yeah, question number 14. So question number 15 to 20. Question number 15 to 20. Question number 15. $32. Okay. 16. Right. And question number 17. Just to go through this. Seventeen. 18. Yeah. Question number 18. Question number 19. Question number 20. Yeah. So there we are. Question number 11. Yeah. Question number 11. So before that, just go through the texts once again. No need to study, just to get an idea of this. Oh. Some students. Today's weekend, so many of the students will be there. Still, today some students. You can also invite some of your friends. So there we go. So we are 7 members plus 1, 8. I'm just waiting for 2 more students. We're going to take a continuous class of part A, question numbers 11 to 20. Then we will move forward to part B and part C. So 7 members. Just recall the points which we have learned yesterday. Yes, 8 members. How can I know to solve part A without reading the 4 texts? That is what I am teaching. Nah? No need to read anything. Just hold on. Forward. Just waiting for 2 more candidates. So, just think about the synonyms which we have learned. First one is what are the synonyms of the word diagnosis? Diagnosis. Yeah. Diagnosis. Diagnosis. Text A is related to diagnosis. So what are the other synonyms which you can use for diagnosis? Yeah. A condition, evaluation, assessment. Hmm. What more words? Result. Very good. Yeah. Assessment, evaluation, testing, diagnosing, signs and symptoms. Whatever you have knowledge, just related. You write, maybe it is right or wrong, that is different thing. Let us make a recap of the previous day's session very fast, and then we are moving. Okay, no problem. If others are not ready to come, we are not going to wait for long for anybody. Okay, we are making some recap. Second one is diagnosis, admission. Admission. That is part B. For part B, admission. What do you think are the synonyms for the word admission? Admission, present, visit, join. Yeah. Too many students have written the test today. That's really a good positive approach. Yeah. So admission. Next one, third one. What is the word for the third point? Okay. Yeah. Third one is timeline. C. That is timeline. Timeline. Yeah. Action plan, steps, procedures, whatever you want to write, write down. Action plan, steps, procedures. You can write all these things. Okay. Then last one, D. What is D? D is physiotherapy. Physiotherapy. So what are the synonyms for physiotherapy? You think? Yes. Right. If you have any friends, you can invite them because we are taking admissions for this Monday batch. So I'm going non-stop. Okay. Until we are going to fill the 3 places. Okay. For doctors and 4 places for nurses. Yeah. Right. Yeah, active, fast. I'll go very fast now. From 1 to questions, 10 questions. I'll go very fast. I'll not go. You will go very fast actually. Okay. Now let us see here. Yeah. Hide floating mesh. Yeah. Right. So this is text A, which says diagnosis. Text A, which says diagnosis. Yeah, submit your answer. Or which text do you think will you get the answer? Yeah, Jackson says C. Avil says C. What about the others? Yes. Yeah, Jana says C. Okay. So yeah, how soon after admission? It's after admission. You diagnose, then only you admit, right? After admission is timeline. So how soon means it's related to time and it should be checked. Okay, if glucose should be checked. That is in timeline. Okay, let us think that it is C is the right answer. Next one. Question 2. Yeah. This is question 2. What needs to happen before a patient can be given food or drink? What needs to happen before a patient can be given food or drink? Yeah. Where will you find? A, B, C, D. Give your answer. 5, 4, 3, 2, 1. Submit. Yes. They'll get a stroke, then they will admit, and then afterwards, after some time, they will give food and drink. Okay, 5 people have given the answer. Yeah. Right. Very good. Very good. All have said it is B. Yeah, you are right. The next one. Third question. A test to be used by first responders. A test to be used by first responders. So when somebody is getting a stroke, then first responders test who can use this one. So A, B, C, D. Okay, question number 3, right? Yeah. Question 3. Yes. 5, 4, 3, 2, 1, and submit. Yes. Yeah. A. Very good. Next question 4. Just a recap. So the third part will be easy afterwards. Question number 4. Yeah. Criteria for deciding whether a brain scan is needed or not. Criteria for deciding whether a brain scan is needed or not. Yeah. Yes. So question number 4. Good. Question number 4. Yeah, criteria for deciding whether a brain scan is needed. So when do you? So most of the, yeah, 10 members are there now. Yeah, very good. So most of them said B and one said A. Yeah, Jenna said A, all the others said B. Yeah, right. So when do you decide whether brain scan is needed or not? Okay, that's very important. So you go for admission. Okay, you go for admission. There you'll get it. So you can check here. So now here. So here, admission. Upon admission, you know what should you do, what you should not do. Okay, age, blood pressure, clinical features. Okay, speech impairment, duration, diabetes. All these points. 1 plus 1, 2, 2 plus 2, 4, 4, 5, 6, 7, 7 points. Out of 7 points, if a person is scoring 4 and above, okay, should go to the specialist acute stroke unit. Okay, that is brain imaging should be performed. All these things. See here. Okay, when admission is done, they'll assess all these things. Then they'll say, according to ABCD score, they will think all these things. Right. Next to question number 5. Question number 5. Yeah. How soon after admission? How soon after admission? This is also same like question number 1, but little difference is there. He is trying to trick you. How soon after admission the patient should be seen by a therapist? By a therapist. Check it out there. A, B, C, D. Then give the right answer. A, B, C, D. How soon after admission the patient should be seen by a therapist? Yeah. Yes. So 5 students have given the answer. What about the rest? Yeah. So majority of them have given D. Yeah, D is the right answer. D is the right answer because therapist is physiotherapy. You're sending to the physiotherapist for. Next, question number 6. Question number 6. Question number 6. Question number 6. Yeah. When a patient should be referred to a neurologist. When a patient should be referred to a neurologist. When a patient should be referred to a neurologist. When means what? Think about that. It will help you for a clue. Yeah, come on. When means what? Yeah. Arish, don't be hasty. Avil, Jana, Jackson, think and write. Think and write. So today is an orientation session for the new students. Okay. So today you can attend the session freely. This is for admissions. Batch starts from Monday. Yeah. Yes, C is the right answer. C is the right answer. Yes. Timeline. When means what time? What time? After 15 minutes or after 20 minutes, after 1 hour? So when a patient should be referred to a neurologist. When means what time? Means after how much time? That is what it is. Next. Question number 7. Question number 7. Yeah. Guidance to be given to those caring for stroke patients long term. Long term. Guidance to be given to those caring for stroke patients long term. Long term. Try to understand. Long term. Okay. Stroke patients are suffering and long term treatment is needed. Then what you will do? Yeah, Rajeshwari D, Jackson D, Simiat D, Avil D, Jenna D. So long term. Long term diagnosis will not be long term. Admission will not be long term. After admission, timeline will not be long term. So physiotherapy will be long term. Exercises should go on for long time. Okay, timeline. After admission in the hospital, timeline, what should be done? This is physiotherapy is the extension. So you understood 7 questions. Very good. Now we are moving to part round 2. Here also you will do the same way. Without reading the questions, without studying anything, you'll get the answers. But you have to go and find the correct answer afterwards. Okay, which text it is, you have to see. Now round 2, question number 8 to 4. Yeah. Now here, question 8. What device can help prevent partial dislocation of certain joints? What device can help prevent partial dislocation of certain joints? Will you get this one in diagnosis? Will you get this one in admission? Will you get this one in timeline? Or will you get in physiotherapy? Imagine. All of you write A, B, C, D. Then I will take you according to your order. Who got more marks? A, B, C, D. I'll take you there. Come on. What device can help prevent partial dislocation of certain joints? Today I'll give you most of the synonyms which will be repeated always. Most of the synonyms which will be repeated always. Yeah. Yes, 8 students participated. Very good. So let us see here. Jackson D, Rajeshwari D, Srija D, Vinita D, Avil D, Simiat D, Arish D, Jana C. Yeah. Now here, yeah, Jana, see here very carefully. What device can help prevent partial dislocation of certain joints? In diagnosis, doctor is diagnosing. Doctor is diagnosing the patient. We don't need in A. Admission, at the time of admission, what you have to do, that is it. We don't need this one now. Okay. Timeline, there is something which we have to do. Timeline, what one by one, what we have to do, that is timeline. And here partial dislocation of some joints is going to happen. Okay, so what is the device that you are going to do it? So there, that is in the last, that is okay, many students have said D. Okay, let us go there to D. Yeah, check it there. Partial dislocation. See there. Yeah. So here, physiotherapy for acute stroke patients. So stroke they got and a dislocation, that means it is acute. Okay, dislocation. Try to understand. It is acute. Acute means very serious. Very serious. Okay. So now if you see here, so that is the point. That is the point. Yeah. Now let us see here. I'll get that word also. Wait. Question number. Yeah. Yes. Oh. Yeah. Yes. Now I am giving that sentence also here. Yeah. This is the sentence. Okay. Let us take this sentence here. Or let us put it here. Okay. Yeah. Now you can see these two relationships. Okay. You can see the relationship there. Okay. Prevent, assist. Okay. Sorry. Help, assist. Okay. Prevent partial dislocation of certain joints. Shoulder. Subluxation. Dislocation. Subluxation. So something related to dislocation. Okay. So device, help, support, help, arm, provide arm support devices, such as lab tray. What device? Lab tray. Here is the answer. You can check it out there. So I have to find out there. Okay. Again, find out like this. So this we have already done. So I explained you. Next one. Yeah. Question number. Right. 8, 9. Question number 9 now. Question 9. Question number 9. Yeah. Now, what form of training may help a patient with impaired balance? What form of training may help a patient with impaired balance? Will you get it in diagnosis or in admission or in timeline or physiotherapy? Come on, A, B, C, D. A, B, C, D. A, B, C, D. Yeah. Yes. So, yeah, it is in D. So, what form of training may help a patient with impaired balance? Impaired balance. Okay, now let us take this one. Okay. This is the question. Okay. Now let us go again to text D. Yeah. This is text D. Yeah. Text D. Yes. That's the question there. So this is the question. Now check your answer for this and submit your answer. Yes. Today's students who participated for speaking are, yeah, I'm checking, cross-checking with the students. Yeah. So Sukhwinder is not in the session today here. Okay, Sukhwinder did 5 speaking sessions. Then Pooja did 5 speaking sessions. Kiran is not here. 5 speaking sessions. Srija, Ravindran, 5 speaking sessions. All of them are doing half an hour each. Okay, very good. I really appreciate. Then Jackson did 5 speaking sessions. Dr. Kalai did 5 speaking sessions. Then Mansi, 3 speaking sessions. Vinita, 5. Hifza, 5. Rajeshwari, 5. Avil, 3. So these are the students who did speaking session. Total today, the speaking sessions conducted are 51. So those who are regularly doing these sessions, okay, for them today, those who completed 5 speaking sessions, tomorrow I will take 1 speaking session. Okay, right. Good. So come on, write down. So here, what form of training may help a patient with impaired balance? Now, where is this impaired balance? You have to notice. Impaired balance. Impaired balance. Yeah, work on balance. Here it is. Work on balance. So impaired balance. Okay. Often leads to reduced confidence, fear of falling, and increased risk of falls. So employ trunk exercise training. So trunk exercise is enough because training is already here. Training is already here. So this training can be eliminated. This training can be eliminated. Okay. This training can be eliminated. So trunk exercise. My God. Right. So that is question number 9. Now question number 10. What should patients who may need fibrinolytic therapy not be given? What should patients who need fibrinolytic therapy not be given? So what should patients who may need fibrinolytic therapy not be given? Okay, fibrinolytic therapy. Okay, what should not be given to them? Now you will find this information in text A or B or C or D. So question number 10. Question number 10. Yeah, where will you find this information? Come on, first. 3 students have given C. Okay, Rajeshwari, walking you wrote. Okay, I will see. Okay, now give your answer there. Okay, I'm taking you to C. Yeah. Some students wrote administer. Okay, what should be? Okay, so try to understand the question. Okay, right. This is the question. Okay. Now, if you see, yesterday one student wrote, okay, what fibrinolytic therapy? Where is fibrinolytic therapy? Okay, lytic therapy is here. If patient is not a candidate, if a patient is not a candidate for fibrinolytic therapy, then aspirin should be given. If not a candidate for fibrinolytic therapy, then you have to administer aspirin. That means they may need fibrinolytic therapy means, okay, try to understand. He is a candidate for fibro. Then definitely you have to try to understand. Okay. So you should not give what? So that's it. So not. So if a patient is not a candidate for PEP, then you should administer aspirin. Okay. Then you should administer aspirin. But if he needs fibrinotherapy, then you should not administer aspirin. So aspirin not to be given. Okay. Some students wrote administer aspirin. No, that's the wrong answer. Absolutely. Okay. That's a totally wrong option. See here, he tricked you. Here he said not a candidate for fibrinolytic therapy, then administer aspirin. But here he is a candidate is who may need, not may not need. Not is not there here. He needs fibrino, does not need is not right. So try to understand that one. Here not is there. This is very important. If he's not a candidate for fibrinolytic therapy, then you have to administer aspirin. But if he is a candidate for fibrinolytic therapy, then you need not give aspirin. That's what is question reverse angle, reverse question. This is called reverse question. So be careful with reverse questions. You will give wrong answers. Yeah. So that's it. Next. Question number 11. Yeah, this is question number 11. Yeah. There are some people who think, oh, we can do it, we can do it. But the thing is, the problem overconfidence. Yeah, thrills, but it kills. Okay. You lose your mark. Speed thrills. Okay, but kills. Don't be overconfident. Try to learn. Slow and steady wins the race. Okay, slow and steady wins the race. Learn slowly so that it will be retained. Knowledge will be retained. Okay. Next. Right. So now look at this question. Look at this particular question. Right. In which text can you find information about how many points on the ABCD scale should you give a patient with slurred speech but no weakness? How many points will you give here on ABCD scale? Should you give a patient with slurred speech but no weakness? So, is it A, diagnosis, B, admission, C, timeline, D, physiotherapy? Yeah, question number 11. Question 11. Yes, now give your answer A, B, C, D. Yeah, give your answer A, B, C, D. Yeah. Yes. Fireball 1-1. Yeah. I made a revision so you could understand some things. Fireball 11, A, B, C, D. Which text will you find this information? Logical reasoning approach. Yeah. Let me take you there. Yes. Just guess and tell me. So B, 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 B. Very good. Come on, what about the others? Okay, let me take you to B. How many points on the ABCD scale should you give a patient with slurred speech? Slurred speech, but no weakness. Slurred speech, no weakness. Slurred speech, no weakness. How many points should you give? How many points should you give with a patient with slurred speech but no weakness? Now let us go to B. Okay. Yes. How many points will you give? So A, B, C, D, B. Okay, next B. So now give the answer. How many points? Check here. Seven, 6, 5, 3, 2, submit. Okay. Yeah, speech. You can directly go there and find the answer. Yeah. So there you are. Yes. See, slurred speech. Yeah. And no weakness. Speech impairment. Speech impairment. That is slurred speech. Slurred is impairment and no weakness. So simple as that. I don't understand why this fellow gave this me easy question. Okay. Slurred speech, no weakness, 1 point. That's it. Okay. Then next, question number 12. First, you have to find, go to the text like that one. Question number 12. Question number 12. Next one. Yeah. Question number 11. Yeah. That's it. Points. On what points? Okay. Then next one. Question number 12. How many points on the ABCD scale should you give a patient whose symptoms have persisted for more than 1 hour? Where will you go for this question? Where will you go for this question? A, B, C, D. Where will you go for this question? We are not crazy, okay? We are very wise people, knowledgeable people. So no need to panic. No need to panic. This is okay. Fireball 1, 2. Yeah. Yes, fireball 1, 2. Yes. Hole A, B, C, D. You know it very easy. No need to think anything now. So it is logical reasoning approach. Just to go there and find the answer. So now let me see your answers. What answers did you give? Majority B, 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 B. Wow, wonderful. You're very clever. I know, no? Huh? I don't know. You're teaching me a lot of things. Okay. Right. So here, copy post link. Yeah, there you can check whether your answer is right or not. Okay. Copy message link. Yeah. You can check there. Right. Yeah. Now here, that's it. Now go there and check the point here. What? How many points on the ABCD scale should you give a patient whose symptoms have persisted for more than 1 hour? Symptoms more than 1 hour. Symptoms persisted more than 1 hour. That's it. So you can go there. Yeah. So go to B. Yes. Now check the answer. Symptoms persisted for more than 1 hour. Come on, check and give the answer. Now tell me, how many points? Yeah, we came to B now. 5, 4, 3, 2, 1. Submit. Simyat, how is it 1? More than 1 minute. Time, more than 1 hour. More than 1 hour. That is duration. Okay. So this is it. Till here only. 10 to 59 minutes, 1 point. But 60 minutes and above, 2 points. That's it. So you confused here, na? 10 to 59 minutes, that you confuse. Simiyat. Patience. Patience. Okay, you can understand now how easily you can be tricked. Okay. 59 is less than 1 minute, right? 1 hour, right? 60 minutes. 1 hour he told, 1 hour. And here 60 minutes. 1 hour means you can understand more than 1 hour. I have to be very careful, my dear. You have to be very careful. Okay. Now question number 11 onwards. So we have seen question number 11 now. So update your score 1 by 1. This is 12. Okay, update scores previous and now. Earlier point is 1 mark. Now points 2 is 1 mark. So 2 marks. Okay. Update your scores. Previous question number 11, if you have given, I'm feeling cold if I'm putting AC. If I'm not putting AC, I'm feeling hot. What is this? Oh, oh my God. Can do me a favor. This one, can you put in 2 points, please? Fan is enough, I think. Okay. Yeah. Simiyat, be careful. See, simply you lost 1 mark. Yeah. Sorry. Yeah. Ooh. Yes, next. Question number 13. What should be administered? What should be administered if a patient has a CGS score, sorry, GCS score of 11? What should be administered if a patient has GCS score of 11? Okay, where will you find this question? Question number 13. Okay, wait. Question 13. Yeah. Where will you find this information? A, B, C, D. Diagnosis, admission, timeline, physiotherapy. Yeah. This is very important. What stage? Many people think that there are three different styles of questions. No. First level and second level and third level. That is it. First questions only will tell you which text. Second one, which text and where to find. Short answers. Third one is first where to find this text. Sorry, which text, then where to find and how to modify it. So three levels are there: gear one, gear two, gear three. But gear one is compulsory for all the three sessions. 20 questions you need gear one. That means you should know whether text A, text B, text C, text D. First important thing. Okay. So yeah, this is Fireball 13. Fireball 13. Okay. Fireball 13. Yeah. Now, where will you go for this one? I think you have already given the answer, but I'll check that one. 1 second. A, B, C, and D. Logical reasoning approach. Yeah. Now, let me see what answers you have given. Nobody gave the answer. What is this? 7, 6, 5, 4, 3, 2, 1. Submit. Where will you go? A, B, C, D. Yeah, brain. What should be administered if a patient has a GCS score of 11? Diagnosis, admission, timeline, physiotherapy. Okay. Now let me take you to there. Most of the students have said, yeah, C. And then one student said B. Come on, give your answer. Most of the students said C. That means timeline. Okay. Then one student said B. Okay, we'll go there to C. Now C. Yeah. GCS. GCS. Find that letters. GCS. Is it there GCS? Is it there GCS? Capital letters. GCS. Is there capital letters GCS? Yes or no? Huh? Whether to go or not is there, okay? Now let us take the other one option. Yeah. GCS. Do you know what is GCS? What is GCS? GCS. Yes, that's it. So, what should be administered if a patient has a GCS score of 11? 11 is not there, but less than 13. Below 13 is there. You can see there. Okay. Yeah, text B is the right answer because it is admission. When you admit, then you will see all these vitals. When the patient is admitted, then you see the vitals. No, these are all vitals. Huh? Age, blood pressure, clinical features, speech impairment, duration, diabetes. Okay. And all these things. See? So, right. You can see there what should be done. Right? So, here it is. If the scores below 13 on the Glasgow Coma scale, GCS means Glasgow Coma scale, and it is 11. 11 means below 13. That means what should be done? What should be done means should be performed immediately. If the patient is on anticoagulation treatment, if the patient has a known bleeding tendency, if the scores below 13, if he has unexplained or fluctuating neurological symptoms, if he has papilledema and neck stiffness or fever, if he has a severe headache, all these things are there, then immediately any one is there, immediately something has to be done. Now write the answer. What is the right answer? Yeah. What should be the answer here? Write down, all of you. Come on. Check and write the answer. If already you found the answer, then that means fine. Those who went for C, they lost their mark actually. But after going there, you will not find that it is not there. So you are wasting your time. That's all. So reason carefully. Yeah, reason carefully. So if you feel that it is right answer what you have given, then you can give. Okay, update your score. You know better. I don't want to see all those things. Update your scores for today. 3 by 3 or 2 by 3 or 1 by 3 or 0 by 3. Three questions, 11, 12, 13. Yeah. Next question 14. Question 14. Question 14. Yeah, this is question number 14. Yeah. In which text can you find information about what complication may be immobile patient be at risk of developing? What complication may an immobile patient be at risk of developing? Where will you find? In diagnosis or admission or timeline or physiotherapy? Where will you find? A, B, C, D. What complication may an immobile patient be at a risk of developing? Yeah. 1 minute. Yeah. Yes, next one. What complication may an immobile patient be at risk of developing? Where will you find this one? A, B, C, D. Okay. Fireball 14. So A, B, C, D. Okay. Yeah. Yes. Fine. So 7 students have said it is in D. Yeah. Dr. Yaman. Dr. Yaman is from Syria. He was requesting for our regular sessions. He's going to join us shortly. He's very serious. He just lost in reading or listening. Dr. Yaman, welcome. I did not notice that you arrived already. I just sent you a link so that you can. Good evening. Good evening. Listening. Yeah. He lost in listening. Okay. Yeah. So let me just say. So he's the person who requested. He's in Saudi Arabia. Dr. Yaman from Syria. Hello, Dr. Yaman.
Hello, sir.
Yeah. Can you introduce yourself?
Yes, I'm Yamin Al-Nakshi. I'm from Syria, currently in Saudi Arabia. I just attempted one time OET, like before less than 15 days, and I got C in C plus in listening. So I joined your classes. Uh, I saw one class actually in YouTube, and it was very good for me to hear the explanations of you. So I searched your OET channel in Telegram and I got your number and just texted you yesterday.
Oh, yesterday you tested me.
Yeah,
I did not notice because I was tired yesterday and slept off. Today morning I have noticed, I think, right?
no problem, sir. Yes.
Yeah. Okay. Your mother tongue is Arabic?
Yes, Arabic.
Okay. I know little bit of Arabic. Very good.
Okay.
Welcome, welcome.
Thank you, sir.
Yeah, fine. That's really very fine. This is Dr. Yamin. There are many other doctors in our group. And to tell you the fact, you are the first student from Syria.
Okay.
There are from Lebanon, Yemen, Saudi Arabia, Kuwait. Many places are there, but from Syria, you are the first person.
Okay.
Yes. Okay, fine. Thank you very much.
Thank you, sir.
Yes. So now, so you have seen complications. So now let me take you to, because many of you have given the answer D. So let me take you to D. Now there you go and check. This is D. What complications? Immobile patient. What complications? Immobile patient. So there you see immobile patient. What complications? Immobile. Immobile. So immobile patient. So you have to make him mobile. He is not moving. Okay. So now check it out. Check it out. Where is the word? What word which you search? Okay. Yeah. Yes. You can check it out. Why are you not active? Come on. Yes. 7, 6, 5, 4, 3, 2, 1. Give the word. Yes. Typed and kept ready. Very good. Very good. Come on. All of you. All of you. What is the answer? Correct answer. What is the correct answer? What is the correct answer? Yes. So how did you get that one? Immobile. The word which is the clue is immobile. Now that one is here. Here. So here. Okay. Mobilization. If it is immobile, you have to do mobilization. Early mobilization. Early means first. Okay. Early mobilization. To provide post-stroke complications. Complications word is here. And what is it? Encourage early mobilization to avoid post-stroke complications such as deep vein thrombosis. Deep vein thrombosis. So DVT. So this is the answer. This is an example. Okay, such as means example. Deep vein thrombosis and many others, but only one is given, that is deep vein thrombosis. Write it as it is. That's enough. So those who got the mark, you can give sub update scores. Those who got update scores, today we have done 4 questions. So out of 4 questions, how many answers you got? Update 4 out of 4, or 3 by 4, or 2 by 4, or 1 by 4. Arish is a new student. Yeah, Ebenezer Kwachi, he is going to join now. And then yeah, that's it. Ebenezer Kwachi, today is the last orientation session for you. So you can consider your registration, because classes start on Monday. And those who, there are only 3 places for doctors and 4 places for nurses. Right. So even before the admissions are filled, you can register fast. Right. So clear all drawings. Right. Fine. 4 by 4, 3 by 4. Yeah. Next question. 14. Finished. Now, yeah. So those who have completed, participated yesterday. Yesterday we have done 10 questions, plus today 4 questions. So totally 14 questions we have done from this one. 14 questions. Okay. Those who have done 14 questions, what you have to do is, you write out of 14 questions, update your scores. Those who did not do 14 questions, those who did only 7 questions or 8 questions, they will write based on their questions. For example, you attended only 4 questions today, they will write just a 3 by 4. Those who attended yesterday 10 questions, those you join and add today. Yeah. Now we are going to the next, that is 15 to 20 questions. Here also it is the same. Next is 15 to 20 questions. Yes. 15 to 20 questions. Now we are going to do. Yeah. Kirumbalini is a nurse from Kirumbalini. She joined. She's a nurse from Sri Lanka. She joined as a guest. Kirumbalini joined as a guest. Yeah. So she's from Sri Lanka. She's also waiting to take the admission. Right. Her duty finished, and just now she joined, I think. Right. Okay. Now this is round 3 questions, 15 to 20. Yeah, get ready. These are 3 levels: gear 1, gear 2, gear 3. First one, you should know which text it is, A or B or C. You should know, you should guess A or B or C. Then afterwards, you should go to that particular area. Okay. So this is, yeah, third gear questions. Till now we have seen second gear questions. These are third gear questions. That means 3 levels: gear 1, gear 2, gear 3. You have to go into 3 different gears. Okay. You have to go into 3 different gears. Now, what is these 3 different gears? So, first thing is, first thing is, you should find out exactly, you should find out exactly which text this question is from. A or B or C or D. So you should first go to that particular, say like this is for new students, which I'm telling you. If you want a pillow, you should go into the bedroom. If you want a knife, you should go into the kitchen, like that. So which question you want, that text you have to go. That's very, very important. These are watertight compartments. So that is how we are doing. So this is gear 1. All the 20 questions need gear 1. Okay. 1 to 7 questions need only gear 1. And all the questions from 1 to 20 need gear 1. That means guessing. Okay. Reasoning, logical reasoning approach. So you should guess which text it will, you have to go. That's it. So 1 to 7. Then 8 to 14 questions, the second set of questions, they are short answer questions. For these questions, first gear is needed. First gear is needed. For every question, you should put a gear 1. That's compulsory. 1 to 7, no need to gear 2. There itself it ends. The next one, second, 8th question onwards to 14th question, you should put gear 1. Then go to the text. Then gear 2, find the answer and write as it is. That is for gear 2. Write as it is. No change. No change. You will write as they are. No change. That's it. There is no change at all. Gear 1, just go to text. Gear 2, go to text and then take the words and write as they are. There is no change. 1 means 1. Deep vein thrombosis means deep brain imaging means brain imaging. You cannot change anything. Unchangeable answers. These are called as perfect answers. You change anything, it's a mistake. So these are easy questions because just copy, paste, just copy, paste, just copy, paste. Nothing else. Nothing else. That's it. Find the answer and write. I hope you understood what I'm telling. Next, gear 3, that is what we are going to do now. 15 to 20 level questions. Here also, you should begin with gear 1, then go to the question and find out the answer and keep that answer in your brain and modify according to requirement. Sometimes you need to change that one, not write as it is. Fill in the blanks. Fill in the blanks. Okay. Fill in the blanks. Remember that. You have to apply some logic here, special logic. Sometimes there will be not in the paragraph. And here not will be removed. It becomes the opposite. Okay. For example, we're going to see all those things now. Yeah. So I hope you understand. This is gear 3. In gear 3, what you are going to do, once again, first put gear 1, find out which text it is, A or B or C or D. Then go there, find out the exact word which is there in the question, which is the most important. Then there find the answer, take it and put it in your brain. Then come to the answer, then modify according to the situation. According to the word before and word after, you have to modify. Remember. Sometimes active voice will be there. Sometimes you have to change to passive voice. Sometimes passive voice will be there. You have to change to active voice. Sometimes they will be there. And sometimes in the question, it will be there. They will give medicine. It will be given. Okay. That's it. They are giving medicine. It is being given. So like that. Modification. Okay, we'll come there now. That's not a big issue. It's very easy to identify. So only 2 students attended yesterday. Avil and Jackson. Jackson got 14. Yeah. All right. This is question number 15. Question number 15. Okay. Function print screen. Okay. Now again here you have to ask yourself. Okay. This is Fireball 15. Yes. Now you should identify which text this will go. Create poll A, B, C, and D. And this is logical reasoning approach. Yeah, right. Now, you're supposed to tell me now. Patients who have had a stroke, patients who have had a stroke, patients who have had a stroke, this is the same for everyone. Be unable to dash, be unable to dash. What a health professional says to them accurately. May be unable to dash. Verb will come, verb. Verb. Patients who have had a stroke may be unable to, maybe understand, may be unable to follow, may be unable to implement, may be unable to understand, to follow, to implement, to comprehend, okay, to digest. So any word came. So here to dash, this is called to infinitive. To infinitive. What do you mean by to infinitive? Infinitive means V1. First form of the verb is called infinitive. V1 is called infinitive. To play, to jump, to sing, to dance, to run, to understand. Understood is V2, past tense. Okay. Understood is V3, perfect tense or passive tense. Understanding, V4, continuous tense. Here, to understanding will not come. Okay. To understand will come. But if for is there, for understanding, write down the words. To understand or for understanding. You have to modify accord. Here, to is there. So understand. But in the paragraph, it may be for understanding. Okay. So it will be in different style. Patients who have had a stroke may face difficulty for, then it should be understanding. There he told understanding, but here he told to understand. You have to modify and twist according to the question. Okay. According to the question, you must understand. That's the biggest problem that you'll be facing here. Now, that's the question. This is gear 3. Take, uh, catch the answer and twist it to suit accordingly. If the ball is coming, you should move that side. If the ball is coming here, you should move. So adjusting the word to fit the question. Okay. So, right, adjust the word to fit the question. So if you have understood what I have told just now, how to adjust, this is called suitability of the answer. The answer taken as it is not suitable. May be suitable, may not be suitable. Here, to dash, there, for dash, for understanding, to understand. There, active voice, here, passive voice. To be understood. To be understood. See there. To be understood. To understand. I want to understand. It has to be understood. It has to be understood. Passive voice. Passive voice. You know, that music, music. Music. You should play the music wonderfully. You have an accordion, or you have a violin, or you have a mandolin, or you have a guitar, whatever it is, even a bulbul, whatever it is, you have to run. Yes. the fingers properly. Otherwise, the music will be distorted. Okay? The music will be distorted and people cannot comprehend. It will be disgusting. Okay? For example, if you say, for understand, it is wrong. For understand? To understanding, that also is wrong. You are doing what you are doing, you are putting a dog's tail to a cat and cat's tail to a dog. Small children, they will be given some pictures. Match the tails. Match the tails. Tiger, lion. Okay, this we used to do when in our beard. We used to give pictures. Here head and here tail. Head of the animals, heads of the animals and tails of the animals. They have to match, draw lines matching them. So tiger and cat. And here tiger's tail, cat's tail. But what this cat's tail will be drawn directed towards the head of a tiger, and tiger's tail will be directed towards the head of the cat. Small children, they don't understand, they don't comprehend. That's what's the problem here in the last three questions. This is gear 3. Gear 3. Not just going to the place, picking. First level is gear 1 is going to the location, A or B or C or D. Second gear is picking the right word. Picking the right word. And third one is twisting it to suitability, to suit. That's it, adjusting the word. Now I'm asking you, have you understood the style of level 3? Have you understood the style of level 3? Just write Y or no, N. For example, there are some books on the table and I picked one. There are some books on the table and I picked one. I picked. What did you hear? Some books. But what would you write here? A book. What is this nonsense? It is common sense. You lack common sense and you lose the answer. You lack common sense and you lose the answer. That's it. Apply that common. Oh, I got the answer. He told some books. I wrote, but OET is not giving marks. You crazy fellow. Huh? You buy things from the market and you are eating as they are. You don't even wash them. You don't even peel them. You don't even chop them. You don't even cut them. Then what's the difference? Human beings and animals, it's one and the same. Why are we cooking food? Why don't you cook food here? These answers are your food. You're taking the raw material and without washing, without cleaning, I got the answer and eating. There's no difference between a monkey and a human being. That's what it is. For this third type of questions will tell us whether we have that common sense, okay, or we don't have that common sense. Here is a big problem actually. How many answers you lost? Almost all, right? Out of 6 questions, you lost 4 answers. That's it. You understand now why you lost the answer? So, people don't even realize. I got the answer. It is there, sir. It is there. Sir. What? It is there. You made a nonsense out of common sense. Okay. You buy cloth from the shop. You buy, for example, online. Okay. There are my friends who buy online. They buy dresses. I see, especially in ladies' styles. My sisters and friends and colleagues. What they do, they buy online. And the size doesn't match. And they go to the tailor. And the tailor does some cutting and trimming and all. So why don't you tailor make the answer for this particular question? Because that style was suitable there in the paragraph, but the same style, is not suitable here. When they made, they designed for that particular style, but when it came to you, it is not fitting you. So you have to tailor make it to fit you. The information which you got in the passage has to be tailor made to fit this particular question. Many people think, sir, I did not take even one question, but I'm explaining. I think you should understand what I'm telling. I tell many students, first of all, when I started telling, they don't even have the interest to learn. It's okay. Answers I can find. I can only correct. My goodness. A person who tells I can only correct is a very highly overconfident fellow, and he will never get the results. It's impossible. There are some doctors who have lost for 4 or 5 times, but they don't even realize that they are doing mistakes while correcting. They themselves are buying trouble for themselves. Okay. They are the problem makers for themselves. This is called self-defeating methodology. Self-defeating. You don't have the knowledge to correct a paper, then how can you correct? You're a student or you're a teacher? Don't correct. You only wrote the answer. That means it is right, according to you. In the answer, it is there, like correct only, sir. I think here in the answer book, he has given wrong. Oh my God. This fellow is a student who is learning, and that person criticizes the person who is preparing the question for him. It's like a chicken, sorry, an egg came and teased the chicken. Egg came and teasing the chicken, teaching the chicken how to dance. Egg, which has not come out of the shell, has started teaching the chicken how to walk, how to fly. Wow, wonderful. Huh? There are some students who really, I feel very sad. They tell me, sir, there was one doctor, one cardiologist, very senior cardiologist. He told me, he and his wife both were my students, and he was very busy. So he asked me to come, and he gave a good fees. No? So that's why I said, okay. He used to send his card to me when I was in the Middle East. He used to send his card to me, and I used to go and teach and come back. So pick and drop their snacks also nicely, wonderful, and a very big hospital. So I used to teach and come. He told, on the very first day, he told, sir, your teaching is very nice, but I'm not a small child. You teach me like this. Then I can understand. I said, you already failed 5 times. Again, you want to fail because you want me to teach in your style, and you want me also to fail. Okay, you do one thing. You go finish the exam, fail again, then come to me. His wife was smiling very nicely, okay, very funnily. Somebody is there to tell you, give you nicely. She was enjoying the moment. Then he was looking at me aghast. Then afterwards, I told her. Then she told, listen to sir what he's telling. Then afterwards, I told him, you are not my doctor here, and I am not your patient. Remember that. The roles are turned. The tables turned. I am your doctor, and you are my patient, and you have number of diseases: grammar disease, vocabulary disease, pronunciation disease, sentence, all diseases you have. So I'm treating you. If I am your patient, you give me a tablet, and if you tell me eat before food, I will eat before food. If you tell me eat after food, I'll eat after food. If you tell me make powder, put in the food and eat along with the food, I'll do it. Undeniably, I'll implement your suggestions because you are a doctor. You are the authority over the subject. How can a patient, I tell the doctor, doctor, tell me to eat, I make it into, put it in water and drink, doctor. Then he will definitely ask me, are you my doctor or I am your doctor? Who is the doctor? You are doctor. Then shut your mouth and listen, you fool. He will tell me. He'll definitely tell me, shut your mouth, don't talk, all this nonsense, you fool, Mr. Peter. I'm the doctor. Listen to me. And I am your doctor now. There are some students who tell me like this, sir, this is very difficult, sir. You teach me like this, sir. You give me 5 minutes teach, sir, 10 minutes teach, sir, and remaining we can do on. Then why are you coming to me? Huh? So learn the technique. Techniques are very, very, very important. There are some students who literally told me, sir, reading and listening will do, sir. Reading and listening will do, sir. Mad fellows, they failed 2 times and then they come to me and again, sir, very difficult, sir. Now I realize, sir, we should listen to you, sir. I should have listened to you in the beginning itself, sir. Making a mockery of our previous tests, and they don't realize. Only after they fall 2 3 times, then they realize the importance of the situation. Okay. No, my students should be awesome. That's the reason why I explain all these things. So third part is the toughest part. Actually, it is very easy finding answer, but when the people build a wall, when the people build a wall, they will start with a full brick. And when they come from this pillar to this pillar, when they come from this pillar to this pillar, they're making a wall. When they come to the last pillar, when they come to the from this pillar, they start with a full brick and come to the last. Then they'll take the last brick and see how much a gap is remaining. The same size of the brick which of piece will fit in that will be chopped with that tool of the mason. Okay, cut properly and put there. Exactly fit that one. You cannot take the brick as it is and put there because it will not fit. That's the point there. Fit it properly. Fit it properly. So if this section you do properly, your score is 20 out of 20. You understand? Your score is 20 out of 20. Part set 3. This is called twisting. Expert only can do this. Expert. I have considered. I have considered. It has been considered. I have considered. It has been considered. I play football. It is played. I played football. It was played. Football was played. There in the paragraph, he says, patients do exercises. Exercises are performed. I am performing the exercises. Exercises are being performed. So try to understand the set there. There you have to take the word and fit in properly here. That's what I'm telling you. Okay, I took so much time to explain you. If you don't understand, okay, we'll see in the next session. This is enough for now, and we are going to the questions directly. Yes, sorry. Question number 15. Yeah. Hmm? Hot water. No. Okay. Hide floating meeting controls. Okay. Patients who have had a stroke, may be unable to dash. To dash. Okay. To understand. to comprehend, to implement. Okay. So like that you have to fit. Okay, now let us see. Now here, the points is patients who have had a stroke, that's common, be unable to dash what a health professional says to them accurately. Health professional tells. Where will you get this health professional? In diagnosis or admission or timeline or physiotherapy? Where do you think you will get this one? Where will you think you will get this answer? So question number 15 is already put here. Okay, now tell me. All of you give your answers, please. The 7 questions I'll explain again every day. I will not explain. Okay, this class will come only after 1 month. Every month I will teach one type. That's all. Yeah. Mm. Okay. So DBD. Okay, right. So majority are D. So let us go to D. Okay. First. Yeah. This is D. Yeah. Can you check there? Did you find any answer? Yes or no? If you find, say yes. If you don't find, say no. So that we'll take the next step. Because I am going according to your mindset. I'm giving you a chance to understand how it is possible, how it is not possible. So have you taken a right direction? Otherwise, we have to back to the pavilion and take a detour. So is the information anything available here? No. Yes. Do you know why you are wrong? You don't know. I'll tell you. I'll tell you. See here. Question number 15. Patients who have had a stroke may be unable to dash what a health professional says to them accurately. Says to them accurately. Try to understand this. Is it related to physiotherapy? Is it related to physiotherapy? It is related to words which are told, spoken words. Spoken words, understanding or hearing, may be unable to hear, may be unable to understand, may be unable to listen, may be unable to follow. Is it related to physiotherapy? Say yes or no. Is it related to physiotherapy? Words, are they related to physiotherapy? Come on, give the answer first. Majority I will take. Is it related to physiotherapy? Come on, give your answers. No. Okay, fine. Now let us see. D is ruled out. Now let us see. Is it in diagnosis? Or is it in admission? Or is it timeline? Now tell me. Think about this one. Now D is ruled out. Think about. Now give your chance. Second chance now. Think about it. D is eliminated. A, B, C are there. Among this A, B, C, give your choice. I'll take majority again. Yeah, one answer is come here. Yeah, Avil says B. What about the others? Yamin says, Simiat says B. 2B, 1A. Come on, others. Unable to understand what a health professional says to them accurately. Maybe unable to understand. Okay. Jackson Kirimi says A. So 2A, 2B, 3B, 2A. Come on, come on, come on, fast. 3B, 2A. 5, 4, 3, 2, 1. So 3A, 3B. Okay, 1, 2, 3. So B's are the first ending and A's are the last ending. So let me take B first. Okay, now let us say B. Yes, here is B. Come on, check in that one. Is it there in B? Check, take time and check. This is admission of the patient. Now tell me, is it there or no? Yes or no? Y for yes and for no. Okay. So Avil says yes. Okay, Avil, which line? Okay. So first line. Swallowing should be screened by an appropriately trained health professional before any oral food, fluid or medication is administered. So this is nothing related to here, I think. Okay, now let us see. The other three students said A. So let us go to A. Yes, check it out here. Actually, you should have observed this is one signs and symptoms to diagnose the thing. Okay, this is what happens. So you're testing. Yes. Have you got the answer or not? This is one sign or symptom of stroke. A person who gets a stroke, he might have slurred speech, or he may stammer, or he may not be able to tell what you are telling. Okay. Tell properly, murmuring, all these things are some symptoms. So there you can see the point. So you all lost in the first step itself. Okay. You all lost in the first step itself. It's okay, no problem. Now I'm going to take you there. Yeah. So diagnosing a stroke or TIA outside hospital is the first stage. For example, when a person suddenly falls down, what you have to do? Okay. The immediate, the first responders, they'll see what happened, what happened. They'll throw water and they'll say, what is your name? What is, okay. Something they'll be asking, then that fellow will react in a different way. First responders. So then they will see he got a stroke and then they will take to the hospital. Okay. That is admission. This is before admission. If people don't know that he got stroke, he will not be taken to hospital only. Okay. Right. So now let us see. They have to diagnose. Okay. Not the official diagnosis. This is preliminary. Right. So by the onlookers who are the watching, suddenly somebody is walking on the road and he falls down and others, okay, they realize that something happened. What happened? How to diagnose a stroke? That's what it is. Or a TIA outside hospital. Yeah. Now let us see. Yeah. So here it is. If so, ask the patient to repeat a simple phrase. If so, ask the patient to repeat a simple phrase. Remaining information is hidden. Okay. Is there slurred speech? Or are there any variations in the repetition? So, variations in the repetition. Repeat became repetition. Here he said repeat. And here he said repetition. See, the word is changed. The word is changed. If so, ask the patients to repeat a simple phrase. Okay. To repeat the same phrase which you have spoken. And if there is any variation, then you will understand that he has spoke. Okay. You should tell him, I'll tell you some sentences, you repeat. Okay. Then when he repeats in the same way, how you repeat the same way, then that is fine. But if there is any variation, that means the problem is there. If the test results positive in any aspect, alert the hospital, check a glucose if possible. That's it. If there is any variation, that means he is suffering from stroke. Just ask him to repeat. That is a bungalow. That is a bungalow. That something variation is there. Finished. That's a stroke. That's how you identify a stroke. So now give the answer. Yeah. Give the answer. Yes, question number 15. Repetition to repeat. Repetition to repeat. Answer is given in two places. Repetition to repeat. That's it. The word is there, repetition. See, are there any variations in the repetition? The word is there. Now, which word to use, repeat or repetition? That's the thing you have to understand. There's a confusion. He has given a confusion. According to the paragraph, you have to write. That's it. Okay. So, patients who have had a stroke may be unable to repeat what a health professional says to them accurately. As it is, he cannot say. That's it. Unable to repeat. Their word is repetition. You may find repeat or you may find repetition or repeats or repeated or repeating. Anything may be there. Is repeated, is being repeated, has been repeated. Anything may come. Or was repeated, were repeated. Anything may come. But here, only one word will come because patients may be unable to repeat. To repeat. 2 will come with V1. S will not come with the 2. 2 infinitive. S will never come. If there is repeats or repeated or repeating, here he used the word 2. 2 will never come in any other form. Write down somewhere. When there is a to infinitive, that means before verb there is to play, to run, to jump, to dance. This is rule number 1 for this question. To will come only with infinitive. That is called V1. And next rule is for. For. F-O-R, for. If the word for is there, it will be V4. It will be V4. V4 means ing form. For repeating. For repeating. For repeating. That's it. This is rule number 2. If 2 is there, repeat. For is there, repeating. These are the secrets. Tuck, it should come on your mind. Many people don't know why Simon sir explains so much. Only those people who stick on and stay, they will learn. Okay, there are students who got 450, 460. Yeah. Next. So now here we'll have 6 questions. 6 questions. So update your score. If you got the correct answer on your own, you give 1 mark, 1 by 1. Otherwise, you give 0 by 1. Okay. You got the answer maybe, then you give 1 by 1. You know better. No need to worry about me. Okay, no need to show me. If you got the answer correctly, okay, at the end of the day, after going to the paragraph, did you get the answer or not? If you write repeating in your notebook, that means it is wrong. Okay, that's it. Next. Question 16. Yeah. Question 16. Question 16. What's happening? There is another mouse you check. Here. A new battery, old battery. New battery, old. I think battery is the problem. Yeah. So, what is this? Yeah, same question. No? First part is same. Second part is a change. Yeah, I think battery is only the problem. Tomorrow we'll buy 2 batteries. Patients. Yeah. Patients who have had a stroke may have noticeable dash to one side of the face. So here the most important word is what? Check that one. Write down the word which is more important. In the second part, patients who have had a stroke may, nothing important in that, have noticeable dash to one side of the face. Come on, tell me which is the, this was in A, right? Okay. Next one. Yeah. Fireball 16. Oof. Oh. Yeah. Fireball 16. Patients who have had a stroke may dash have noticeable dash to one side of the face. So which text you will find this one? A, B, C, D. Now you will not do a mistake, no problem. A, B, C, D. Come on, type your word, letter A, B, C, D. Okay. Let me check what you have written. Yeah. So most of you have written A. So let me take you to A. Okay. Let me take you to A. Yeah. Apply fast. Face, arm, speech test. Face is here. That is the word which will help you to go to A. That is the word which will help you to go to A. Kirubalini, very good. I was waiting to see you. I tried to reach you, but I think you are very busy. I kept your place like that only. Okay. So you can register today if you are comfortable, because the Monday batch is starting and today we are closing the admissions. So those who are interested can take the admission today itself. There are 3 places for doctors and 4 places for nurses. Right. So now tell me. So here, face. Face. Yeah. Now check your answer and you write your answer. Don't bother about the others. Okay. Don't bother about others. You bother about yourself. Na? Face. Apply fast. Fast means face. So where is that face? Right. Ask the patient to smile. Look for any evident dash on one side of the face. So face is the word which will help you to go to text A. Their face will be helping you. So face, here is the answer. That means question is here. Answer is here. What? What is the word? Yes. The word is drooping on one side of the face. That's it. Drooping on one side of the face. Okay. Yeah. Yes. So update your drop. From where drop? It's no drop. Okay. Simiath. You're very clever. I don't expect this answer from you. Question number. Okay, update score. 2 questions we have done. 2 questions we have done. Update the score. Yeah. The next is question number 17. Question number 17. Okay. Patients who have had a stroke may be unable to prevent one outstretched arm from dash. Okay. Yeah. Where you will go, A or B or C or D? Okay. And what is the word which will take you to there? You will go to A. Okay. Yeah. So What is the word which will take you? Arm. Okay. So fine. We are going there. 1 second, 1 second. 17. Hide floating meeting. Yeah, let me take this. You'll get 20 out of 20 if you do like this. Because this is the part which will trouble you a lot. You think you will be writing correct answer, but still, you may lose the answer. Yeah. Yes. So you say it is in A. Okay, let me take to A. Okay. An outstretched arm from dash, unable to prevent one outstretched arm from dash. Okay, let us go to A. Okay. So fast, face, arm, speech, test. Arm, yeah. Be very careful, huh? Be very careful. It is going to kill you, this answer. Definitely, if you are not A grade student, you'll definitely lose this mark. You must be an A grade student to get this mark because you cannot modify unless and until you get it right. Yes. Now, yeah, write the answer. 7. Only when I tell you, submit. Okay, only when I tell you, submit. Until then, you type and keep it there because I want everyone to write at the same time. Nobody should be influenced by the others. Yeah. 11, 10. Write and keep the answer. Nobody will post. 9. You want the question again? Huh? Okay, wait. I'll bring the question here, please. Somebody is asking. I should attend them. Please. Yeah, of course. You are genuine. Your question is Your request is genuine. Okay, absolutely genuine. I should have done it myself even before you ask. Okay. So good. You people are ready to ask like that. Simiyat, very good. I like it. I like it because you need to know, nah? Yeah. Come on. Yeah. So I'm going to give you the question here. Yeah. Yes. This is the question. Okay. So now check it out. If your answer is correct, that means you'll definitely get 20 out of 25. Definitely. No doubt. This is the question which is the last question for you, which only a person who can get a 20 out of 20 can answer this question. It's not a joke. Yes, think very carefully and answer. That's why, yeah. 7, 6. Again, I'll count from 10 because I have put this time. I have taken some time. Yeah, 10. This is the toughest question. 9, 8, 7, 6. Test yourself whether you'll get 20 out of 25 by this. 20 out. If you can answer this question, that means you are eligible to get 20 out of 20 without fail. This is my challenge. Mark my words. You are worthy to get A grade. Yeah, 4, 3, 2, 1. Submit. Yeah, how many of you will give the correct answers? Let me see. Srija's answer is wrong. Okay. Then Avil's answer is wrong. Kirubalani's answer is wrong. Come on, write down. I'm telling you, na. Try all your options. Vinita's answer is wrong. Avil's answer is wrong. Yeah, challenge. This. If you do this answer, it will be 20 out of 20 for you. Yeah. Only one person gave the correct answer. That is Kirimi Jackson. Drifting downwards. S is there. That's why you lost Srija. S is missing. Okay. S is missing. That's why you lost this mark. Okay. Even one letter, you'll miss the mark. Don't think that you'll get the mark. Okay. Drifting downwards. Okay. Here, the clue is to drift downwards. But here, in the question, to is not there. It is to prevent is already there. To prevent. To is already there. To will come V1. To prevent or to drift. That is already gone. To. Okay. If 2 is there, to drift downwards will be correct. 2 is there, so drift downwards. But he modified, he confused you by giving the word from. From will take the gerund, not the to infinitive. Same like for. From and for, almost the same. I saved the animal from dying in the wilderness. From dying. I saved that person from falling down. Okay. From falling down. Ing. From will come with ing. That's it. I told you, na? I told you. It's not an easy task. If you had given this answer, that means you can get 20 out of 20. Definitely. No doubt. It doesn't mean that always it works. Huh? Some students may know this, some students may not know that. That also is there. Okay. So, sometimes it may be a lottery even. Sometimes it may be a lottery even. Okay. So, what you have to do is put the word there and think about all the options and you'll can set the answer right. Yeah. Next, question number 18. I'm rushing forward. Now you understood very clearly. Yeah. Now, hide floating meetings. Yeah, question number 18. Question number 18. Patients who have had a stroke may be assessed twice on the DASH scale to ascertain if symptoms have diminished. Patients who have had a stroke may be assessed twice, 2 times, twice assessment on the scale to ascertain means make sure of. Write down. Means ensure. Ascertain is a C1 or C2 vocabulary. Somebody find out, let me know. Ascertain. Most likely it is C2 vocabulary, like ensure. Okay. Yes. Right. Ascertain. Question number 18. Yeah. Fireball. Fireball. 18. Three more questions. I'm eager to wait for part B and part C. I feel like crying. You lost your mark. What to do? My students don't get mark, na? I feel sad. What to do? Okay. What's there? Not there. Ascertain. Oh, maybe spelling you did not check properly. Yeah. Formal to make certain. Ascertain. I did not give. Ascertain. Ascertained. Formal. Formal is a very powerful word. It's almost C1, C2, but they did not give. Even higher than that, we can say. Ascertaining. Okay. Is equal to ensure. Means make sure, that is B2. Ensuring. Yeah. Ensure. Yeah, ensure is B2 vocabulary. Confirm. Confirm is B1. Confirmation is B2. Okay. Right. So, where will you find this information? A or B or C or D? A, B, C, D. Logical reasoning approach. Logical reasoning approach. Where do you think this is? A or B or C or D? Yeah. A or B or C or D? Yeah, thank you, Mira. It's a formal word. Yeah. So Jackson says B and Avil says C. Come on. People who have had a stroke may be assessed twice. On the dash scale, A, B, C, D. Diagnosis, admission, timeline, physiotherapy. So upon admission in the hospital, this is before that a diagnosis. After admission, then timeline. So where will you find B or C? So many people are saying C, so let us go to C. Okay. Question number, yeah, taking you to C. Yeah, this is C. Come on. C is right. Come on. Find out the answer. Assess it twice. Assess it twice. Assess it twice. Twice. What is the second word for synonyms for twice? Do it 2 times. Twice means 2 times. Double, duplicate. What are the other words? Come on, give the synonyms. I can give you. I already got. But you tell me. No need to go to the text. Think about the words. The same word you will not get. You will never get. Hmm. Yeah, repeat. Double. Okay. Retake. Repeat. Yeah. So you can see there. What should be repeated? What should be taken twice? See there, he's telling what should be repeated twice. It is already taken at 25 minutes. And then again at 45 minutes, it is coming. Repeat NIHSS or 25th one. NIH stroke scale. But in the question, scale is already given. In the question, scale is already given. Yeah, already given. See here. So this answer will be found in 2 times actually. It will be found 2 times. So here at the 25th minute, you will do neurological examination, that is NIH stroke scale. So that's it. Then again at 45 minutes, okay, you will do repeat NIHSS. Are defects returning to normal? Okay, that's it. So this is NIHS scale is already there. Okay, so be careful, right? Mm. So repeat is already there. So no need to write repeat. Twice is already there. So NIHS, that's enough. Right. Update your scores, please. Yeah. And next. No need to do 100 tests, okay? Do 10 tests properly learning and then afterwards do test. There is no meaning in doing 100 tests. Daily doing test without any progress, nonsense things doing, okay, and disturbing your peace of mind. No need. Yeah, question number 19. Question number 19. Yeah. So, patients who have had a stroke may benefit from exercises designed to make dash stronger. Patients who have had a stroke may benefit from exercises designed to make a dash stronger. Okay. Now think about this. What is the keyword which will help you? What is the keyword which will help you to decide where to go, A or B or C or D? So fireball 19. Yeah, fireball 19. Now tell me where you will go. Last two questions. Last two questions. Yeah, logical reasoning approach. Yeah, tell me, type the word which will take you to particular. Yeah, yes, please. You have already written? Okay, exercises. Now tell me A or B or C or D. Now tell me. Type one letter. Come on. Yeah, war one sided. Very good. Yeah, all of you type, na? Okay, let us take a D, suppose. Now let us check afterwards. D. Yes, here it is. Uh, yeah. Now check and find the answer. Okay, we have gone there. Okay. Do you want the question also? I'll bring, no problem. Okay. 19. Yeah. I'm bringing the question also here. Yeah. So, check. Is it right? Check there. Did you get the answer? Patients who have had a stroke benefit from exercises designed to make dash stronger. So, is this answer correct? D. Did you find the answer? Anybody? Did you find the answer? Yeah. No. Okay, now I'm giving you another chance. Okay. I'm giving you another chance. Okay. I don't understand. You are matured people and you are saying no. You're saying no. How can you say no? Answer is not here. Huh? How can you say answer is not here? I don't understand. You're not even thinking about these things. Okay. Try to, okay, think properly. Reason properly. Think. Think here sufficient place is there. Think. Yes or no. Those have given an answer no. Rethink. How can you say blindly that answer is not here? Answer is here. Read between the lines. The answers will be twisted for such questions. I told you. Okay. Exercises. Patients who have had a stroke may benefit from exercises designed to make dash stronger. Okay. Yeah. Answer is there. But answer is twisted. This is the 19th or 20th question. Okay. You're right. Till now, you're right. Think about that. Okay, fine, no problem. If you did not get, that's no problem. Wait, I'll give you another chance. Okay, now let us go to C. Check here, anything is there. Check, 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 take, waste your time. It's like taking your food to your mouth, but suddenly somebody shouted and all your food fell on the ground like that. You almost came to the answer, but you lost it. Nobody can come. It's very difficult. These questions are very difficult. I'm telling you, na. Okay. Next, let me take you to B. Check. Check, check. Anything is there. Yes, now I'm taking you to A. Check, check, check. Okay, I'm taking you to D again. Check. Clues are given many places. Clues are given many places. Somebody gave the answer. Let me at least hint that one to you. Check through the answers. Some people gave the answers. There, one of the answer is right. Okay. One of the answer is right, but not very exactly. Word taking you to the point. Yeah. One word is taking you there. Yeah. Come on. Exercises means training. I thought exactly lecture is finished. I'm going to finish 2 questions. Exercises means training. Okay. Training means course. Training means course. Exercises. Okay. Right. Now at least find out. And you see here from the beginning. See here from the beginning. Okay. Right. Arm. Okay. Shoulder. Okay. Training. Okay. Some clues I am giving you. Oh, oh, this also has problem now. Okay. Yeah. Training. The next one. See, I'm showing you clues. Limb. Hand and foot. Relations are building up. Okay, relations are building up. Then next. Arm. Arms. And hands. Patients with a difficulty standing. Standing with what? See the words which are given already. Okay. Task specific training while standing. So exercises for standing, which make exercise designed to make dash stronger. Now relate. Yeah. Exercises designed to make dash stronger. What do you think? Standing balance is an exercise. That is only exercise. Exercise is standing balance is exercise. Come on, try to think about it. What? Shoulder. You stand with your shoulder, Jackson. Yeah, limb is correct. 1 point is correct. Limb is correct. But still it is not correct. Only one limb you have. You have 4 limbs. Which one? Get it proper. A part of the answer is coming up. Not shoulder. Limb, okay. The limbs, okay. But which limbs? Which limbs? You stand with which limbs? Lower limbs, yeah. One question will be there, topmost question, which needs lot of reasoning. This is that. This is the 90th or 19th or 20th question. If you get this question, that means you'll get 500 out of 500 or 20 out of 20. That's it. Okay. All the questions are not easy. Otherwise, everyone will get a 20 out of 20. Na? Common sense. That's it. We have to use a lot of our wisdom. Use our knowledge into wisdom. Transform our knowledge into wisdom. Okay, update your scores. update scores. This mark you lost, all of you lost this mark. That means getting 20 out of 20 is not so easy. You should realize that. Lower limbs. Next. Oh. I think this is finished battery. Okay. One more was there somewhere. Oof. Yeah. Okay. So next question number 20. Question number 20. 1920. Yeah. Last question. This is a question which will kill your time. Remember, 19th question will kill your time. If it comes in the 16th place, then you will lose 5 marks because you will be destroyed there. So, fireball 20. Now tell me, where do you think this answer will be there? Okay. 1 minute, please. Create poll. A, B, C, D. Quiz mode. Logical reasoning approach. Logical reasoning approach. Yeah. Patients who have had a stroke may present with a low level of dash in the blood. Patients who have had a stroke may present with a low level of dash in the blood. This is simple as that. That's why you have to check for this one. They told already, you have gone through this point already. Okay, where will you see? Diagnosis or admission or timeline or physiotherapy? Check for something. Okay. If the score is something, you have to check. In the case of, yeah. So which point do you think? A, B, C, D. Yeah. So where should I go? A, diagnosis. What about the others? Okay, many students said A, so let me take you there. Yeah. Come on. What should you check in the blood? Blood dash level. Yeah. Come on, write your answer. Write your answer. Yeah. So, is it glucose? Is it glucose? Check properly. Don't be in a hurry, na? Is it glucose? Are you sure? Is it in A first of all? Is it A first of all? I have a doubt. Okay. Check to B. Go to B. Is it there in B? Or is it there in A? Blood. Blood. Where is blood here? Hmm. Is there anything related to blood here? Level of in the blood. Okay, tell me, take you to C. Yeah, check here properly. Pass the share. Yeah, check here pass properly. Now tell me A or B or C or D. Yeah. Yeah, tell me. Which A, B, C or D? The word is understood, but whether you understood the word or not is important. Question is considered hypoglycemic. Tell me what is the answer. Yeah. So Dr. Yaman and Kirbalani from Sri Lanka. So you are selected and your admissions are pending. So finish as far as possible. I'll keep it open tonight because tomorrow it will be completed, and even if the seats are not filled, the course will continue from Monday onwards. So 3 places for doctors and 4 places for nurses. And today is an open session. From Monday onwards, there will not be open sessions. Yes. So update your scores out of 20. Update your scores out of 20. Okay. Yeah. Now I'll give a chance for some students to speak. They are, let me see, Jackson Kirimi, who joined yesterday. Yeah. Jackson Kirimi. Next, Yamen, your turn. Jackson, can you unmute? Okay, 1 minute. 1 minute. Allow participants to unmute. Yeah, Jackson Kirimi. Jackson Kirimi is from Kenya and now he is in the UK. Yeah, Jackson Kirimi. Busy, I suppose. Yeah. Avil 16, Rajeshwari 15. What about the others? Okay. Jackson last time. Okay, Yaman. Hello, Dr. Yaman. Can you share your experience? This is the first lesson with me. How was the session? Yes, Dr. Yaman. It's your time now.
Hello, sir. Hearing
Yeah.
me? Okay.
Yeah, you can share your experience.
Very constructive experience. The issue is that how to dissect the question is very important for students, and I'm learning it now from you. I think it's the proper way to pass this exam.
Right. Okay. Thank you very much. Can you introduce yourself in a few words?
Me, sir?
Yeah. Where are you? What is your profession? You said pediatrician something, right? Yeah.
Yes.
Share your share. I'm giving you 1 minute to explain everything about yourself.
Yes, Yemen al-Naqshi. I'm Syrian, located now in Saudi Arabia. I'm 42 years old, and I'm willing to register in GMC as part of registration in UK. So in order to pass that, in order to accomplish that, I have to pass the OET. I took one trial, as I said mentioned before. I dropped in listening, but others were acceptable actually. So I'm a pediatrician working in one private hospital in Saudi Arabia. And I hope that I can finish this exam while like within 15 or 1 month maximum to complete my registration.
Yeah. Very good. You will not finish this exam. You will crack this exam.
Yeah, I hope
Okay.
so, inshallah, sir. I hope,
Okay.
inshallah.
Enta tinin warbain sana, right?
Sorry, sir.
Enta tinin warbain sana.
I'm not hearing well, actually. Sorry.
You're not able to hear. Enta tinin warbain sana, sir.
I'm not able to understand this word, sir.
Itnin warbain sana.
42 sorry 42 سنة yes
Walaikum salam. كيف الحال?
الحمد لله الحمد لله
Okay. أنا 54.
ما شاء الله ما شاء الله.
Okay, fine, fine. I just wanted to give you a surprise.
Thank you very much. It was actually a surprise for me. You
Of
can speak
course.
Arabic and you can understand some words.
أنا معلوم يكتب عربي.
Good. Yesterday
Okay.
you were able to read one name in Arabic actually.
Okay, okay.
during the meeting.
Yeah,
Yes.
yeah, yeah. I wanted to know who you was the guest, na? So I
Yes.
just
Yes.
yes. Okay, fine. That was very nice talking to you. So your admission is waiting. You can finish it off. And
Okay.
Kirubalani also, and all the students, thank you very much. This was a wonderful session because the serious students, then only I can explain. People are not ready to even attend the session. People are not ready to listen to the session. So how can I explain? When I tell them no, when I give them freely, they don't respect. They'll think that they are biscuits and throw them off. They don't even value them. They think that they are glass pieces. They give less value to that when I say, come, I'll teach you, come, I'll teach you, come, I'll teach. But those students who suffer the pain of losing 2 or 3 times, then only they will realize the importance of these lectures. So that's the problem. So I'm very sorry for them. When I start telling them, they don't understand. Lastly, when they realize that one, then they start respecting, and 100% they'll be devoting their time. That's it. So anyhow, thank you very much. That's all for now today, and we're going for dinner. That's the end of now session. Then after dinner, maybe we'll join for another session, that is part B, and if time, God willing, part C. That's right. Have a nice day. Good night. Bye bye. See you all. And before leaving, share your feedback. And for those who are on the YouTube watching this program, I know you'll be watching till the end, definitely, those who are watching. Otherwise, they will be watching in shifts, 1, 2, 3, 4 times in parts and bits and pieces. So that's fine. Right. So this is Simon Peter, Grandmaster class from Classical Corrections. And for the students who are on the YouTube, this is a message. We have 3 places for doctors coming up from Monday. Already 2 are in pending, 1 doctor and 1 nurse. And we are waiting for 2 more doctors and 3 more nurses. Total 7 students for Monday. So today and tomorrow are your chances, because Monday we start, and after once we start, there are no admissions again into the same batch. So please get back to me. And to tell you about myself, I am not a nurse. I'm not a doctor. I'm a teacher, and I'm proud to say that I'm a teacher by profession. And I come from a family of teachers, and I have an experience of 35 years teaching from KG to PG. Right. I'm a double graduate and a double postgraduate, academically qualified, professionally trained, and with a good amount of experience, and certified from Cambridge University, CELTA, Certificate of English Language Teaching to Adults. So if you're really interested, if you're serious, then get back to me. Have a nice day. Bye bye.